Rheumatic and Congenital Hearts, Global Arch. Thank you very much for joining today. We're really excited to provide an update to you about the call to action and the World Congress, as well as next steps. And thank you everyone for joining either late, early, or middle of the day where you're located. To get started, we're going to do a quick survey to see where you're at and where you're calling from. What country are you calling from? So in order to do this, you'll need your computer or your phone and to type in menti.com in your browser, whatever internet browser you use. And you'll also be asked to enter a code. The code is listed on the screen. It's 2403966. And we'll also place a link in the chat for you.
And Kate, I can share my screen and show folks where people are calling in from.
Go ahead, Katie.
Can everyone see this?
Yep, we can see. So it looks like we have a large number from the US, Pakistan, Switzerland, Lebanon, Nepal, Greece, Canada, India, the UK. So as a reminder, the website is menti.com, MENTI.com, and the code is 2403966.
There's also a link in the chat that you can just click and directly go there. So we'll give folks another few seconds here to reply, and then keep this bookmarked because we'll use this for another question later in the call. All right, I think we'll stop there, and I'm going to hand it back over to Kate to keep us going.
Thanks, everyone. It's great to see how everyone's calling from all over the world. Thanks so much for joining today, especially as I know it's quite early where some people are late. So as Katie mentioned, we will show this again later in the presentation, but want to give you a little practice trying it out now. So it is now my honor to present to you our featured speakers for today. After talking a little bit about each of our speakers, I'll show you our agenda for the meeting today and then hand it over to our speakers. So first we have Bisha Javela, who's the Vice President of the Global Strategy and Advocacy at Children's HeartLink. She serves on numerous boards and committees, including Global Arch's Board of Directors. Dr. Jeff Jacobs is a professor of surgery and pediatrics at the University of Florida Health Congenital Heart Center and Shands Children's Hospital. He also served as the co-chair of the 8th World Congress of Pediatric Cardiology and Cardiac Surgery this past August. And Amy Verstappen, who's the co-founder and president of Global Arch. She's been a patient advocate for over 25 years and has worked with patient and professional groups around the world. Bisha, Amy, and Dr. Jacobs, along with the Advocacy Steering Committee, led efforts during the recent World Congress for Global Advocacy from the Global Village, Call to Action, and many other activities. I also want to say a special thank you to Katie Kraft at Children's HeartLink for all of her work behind the scenes. As you can see, she makes it all happen. I'll now hand it over to Bisha, who will be presenting, whenever my slides will let me, there we go, we'll celebrate the call to action. She'll present some updates about the call to action, what's happened, and then hand it over to Jeff Jacobs, who will talk more about the World Congress and what happened at the World Congress and the success and all of the different meetings. Then Amy Verstappen will talk more about Global Arch, as well as the next steps from the call to action about the coalition. And then we'll open it for discussion and feedback. We'll break out into breakout rooms and we'll provide more information about that during the presentation. And then we'll wrap up and talk about next steps. So for now, I'll hand it over to Bisha, who will talk about the call to action.
Thank you so much, Kate. Hello to everyone. Good morning, good afternoon or evening to wherever you're calling from. I will start sharing my slides. I really appreciate everyone coming together and being interested in what we have to say. If you're here, this means that you were either signing one of the signers of the call to action that we were promoting during the World Congress in August, or you are participants in the Global Health and Advocacy Village. And so what we wanted to bring everybody together today is to give you some updates about what happened. Again, to thank everyone for the support, and then think of what could next steps be. So what did we decide to do as advocacy activities during the World Congress? We actually had a committee that was led by Amy Verstappen and me. And it was a committee of representative of people from different countries and different clinical specialties, where we discussed a lot of different advocacy activities, two of which were the call to action and the Global Health and Advocacy Village. We had three goals. One was to raise awareness. One was to develop advocacy skills for organizations that were interested in being global advocates. And one was to create shared experiences to develop future advocacy opportunities. And so in terms of raising awareness, we were hopefully all familiar with the call to action, the Washington, D.C. call to action addressing the global burden of pediatric and congenital heart diseases. If by some chance you have not signed it, here's the QR code again. If you would like to join us and sign that call. We were calling in that document, we were calling for increased capacity for people with pediatric and congenital heart diseases, building pediatric and congenital cardiac workforce, closing the data gap, and better financing. And the primary audience for this was policymakers. There are many other audiences, but ultimately for us, this was a goal that we wanted to change policies around pediatric and congenital services globally, and addressing specifically the gap in care in low and middle income countries, where some of the organizations that were participants in the Global Village do a lot of their work. So the call to action was endorsed by over 1,500 professional societies, hospitals, and non-governmental organizations, very importantly, patient and family organizations, and many, many individuals. We were happy actually to say that over 1,000 of those signatures were collected before the World Congress started. How will we use it? We will use it as an advocacy tool to gather more support from governments, from multilateral organizations, private donors addressing the global burden of pediatric and congenital heart disease. And we want everyone to see this as a tool that they can be using in their advocacy efforts. That it's based on previous advocacy documents that have been published, maybe some of you are familiar with the Invisible Child series, calling for those changes in policy, basically. In terms of the Global Health and Advocacy Village, this was a goal of the executive committee that was running the World Congress, and I think Dr. Jeff Jacobs will talk about this a little bit later. But the objectives were very similar. We wanted to provide educational opportunities, collaboration opportunities, and a platform for collective advocacy, as well as promoting the call to action. We had participants from both patient and family groups from around the world. Many of the low-income, middle-income participants were sponsored by Global Arch, the Global Alliance for Rheumatic and Congenital Hearts, as well as the Executive Committee of the World Congress gave discounted participation to everyone who was participating in the Global Health and Advocacy Village. We also decided to organize some advocacy activities because we had a great opportunity being in Washington, D.C., to meet with organizations that are influencing health policy in low and middle income countries, namely the USAID, United States International Agency for International Development, as well as the World Bank. And so we brought a group of representatives from the World Congress to discuss those exact same issues that we are discussing in the call to action. And finally, we post World Congress, actually, I just wanted to point out that we also use the call to action to advocate at the United Nations. So the United Nations has a General Assembly meeting every year in September, and we partner with a couple of other organizations focused on birth defects to advocate for birth defects, again, policy changes. And the meeting was co-sponsored by the Ministry of Health of Malaysia and Bulgaria. So what's next? What's next is we would like to actually propose that we build together a coalition, an advocacy coalition that will be hosted by the Global Alliance for Rheumatic and Congenital Hearts. And if you're here, you already know who Global Arch is. You will have a chance to hear a little bit about it from Amy Verstappen, its president. But we also would like this coalition to focus on advocating together globally. And the global space is mostly situated on multilateral organizations like the World Health Organization or the United Nations. A little bit of history that I just wanted to present is that in 2021, several NGOs actually got together and put together a coalition already that was going to advocate together. We discussed different advocacy opportunities in some publications, actually. And out of these discussions, we produced a very important publication at middle of last year called the Recommendations for Pediatric and Congenital Heart Disease Services in Low and Middle Income Countries, which gives a really important information to policymakers about how to develop pediatric cardiac services. So I just want to say that we are not strangers to organizational collaborations. But I will stop here and I'll pass it off to Jeff, who will actually give us a little bit more information about the World Congress and how the World Congress, the goals in terms of advocacy for the World Congress. Maybe some of our slides will be similar, but Jeff is a great and engaging speaker, and he will tell us what their achievements have been. Thank you so much.
I hope everybody can hear me okay. So I'm trying to
Yeah.
find the correct slide deck, so just give me 1 second. Hold on. There we go. Perfect. Okay. Can you guys see my slides?
Yes.
Yes, we can.
Perfect. All right. So my job is to talk a little bit about the World Congress and its relationship to these wonderful advocacy initiatives that Bistra just shared with us. And I'm going to take this group through a 10-minute summary of the 2023 World Congress, who was there, what we did, and the importance of advocacy at the World Congress. For me and for Gil Warnofsky and for the International Steering Committee, the purpose of the World Congress centers on advocacy. And as I show a few slides, I will share those points with all of you. The World Congress was held in Washington, D.C. in August, at the end of August this past year. There was over 5,000 people in attendance. I would start by saying that the World Congress has an important history, and a lot of this history has been published. We use the term the Olympics of our profession because the World Congress has held 8 meetings every 4 years, going back over 30 years. This is the first time there was actually 6 years between meetings instead of 4 years between meetings because of all the misery associated with COVID. And there's many articles that I've written that describe the history of the World Congress, which is long and colorful. I want to talk more about the why of the World Congress. And I think this summarizes why we have the World Congress in one slide. It's to make life better for our patients and their families. The World Congress had a mission statement and a vision statement. This is the mission statement: to improve the global standard for pediatric and congenital cardiac care. This is our vision statement, which is on our website, which was to organize the most comprehensive scientific forum ever convened for this patient population and their caregivers, to improve the duration and quality of life for neonates, infants, children, and adults with pediatric and congenital cardiovascular disease. So clearly that includes both congenital heart disease and rheumatic heart disease. We have a series of core values that include diversity, advocacy, training, sharing of best practices, interdisciplinary collaboration, interinstitutional collaboration. When we arrived at the World Congress, 5,560 people had registered for the meeting, making it the largest World Congress ever, and also the largest gathering of healthcare professionals dedicated to pediatric and congenital cardiac care ever held. By the time the meeting was over, we went from 5,560 to 5,750, because close to 200 people in addition to that group registered at the meeting. These people came from all over the world, 117 countries. And this is a map of where the people came from. This is the group from South America. We can see we have extensive representation from Brazil, Argentina. This is the representation from Africa, and we were very proud to have multiple attendees from a variety of countries within Africa. Here we can see the Middle East. Here we can see Asia and 321 attendees from Asia. Here we can see the 95 attendees from Australia, as well as some attendees from other islands, including New Zealand. And then here's our attendees from across Europe. So clearly we had global representation. The biggest continent attending, obviously, was the United States, and just over half the attendees came from the United States and Canada. North America was clearly the largest colony, or the largest continent of attendees. The demographics of the faculty is also important. We had a faculty of 931 members from 63 countries, a few more men than women, and about a third of the faculty was young faculty, less than 15 years in practice. The scientific program and faculty also came from all over the world, as shown by this map. We did not have any pediatric cardiologists from Antarctica. If anybody knows anybody to represent Antarctica, we can get them involved in the next World Congress. Nursing, there was a tremendous nursing initiative at the World Congress. 900 attendees were on the nursing track and were nurses. And this is the first time World Congress has such a large representation of nurses, and that's something we're very proud of. These are the articles that have been published so far documenting history of the World Congress that I described before. We're preparing an article that will summarize everything I've said about the 2023 World Congress to publish in our journal, Cardiology in the Young. This is a list of kind of the track record of how all this happened. There was once an individual World Congress of Pediatric Cardiology that met in 1980, 85, and 89, and a World Congress of Pediatric Cardiac Surgery that met in 88. And on this slide is the cities that those World Congresses were held and who led the meetings. And then in 1993, the World Congress of Pediatric Cardiology and the World Congress of Pediatric Cardiac Surgery combined, and that led to the first combined meeting in 1993 in Paris. And since then, it's gone from Paris to Hawaii to Toronto to Buenos Aires to Australia to South Africa to Istanbul. And Washington, D.C. was the first time that this meeting was ever held in the continental United States. This is a picture of Jane Somerville, who was one of the leading founders of the World Congress and was very influential in creating the World Congress, the first combined World Congress that was held in Paris. This is actually Jane Somerville visiting a heart surgery mission in Jamaica. This is the International Steering Committee. I know several members of this International Steering Committee are actually on this Zoom call. And this is the group that leads the World Congress and provides consistency from year to year to year. Since this was the picture of the steering committee when we entered the meeting in Washington, D.C. Since that time, we've had some refreshing of the membership with the addition of Mitch Cohen and the retiring of the membership of Gil Wernosky. We've also operationalized an initiative where 6 new members will be welcomed to the steering committee in our next meeting, which will be in June in Italy. And those 6 new members are going to be selected with the sole goal of enhancing the diversity of the steering committee. Anybody looking at this picture will realize that this current steering committee is suboptimal when it comes to diversity. And when I took over as chair of the steering committee, we had an extensive discussion about this problem at our last steering committee meeting. And the steering committee is committed to improving the diversity of our steering committee, and 6 new members will be welcomed with that goal as the first step in what will be a process to make sure that the steering committee is more representative of the human beings that actually live on the planet. This is an article that Bistra referred to about advocacy. This article is published in Cardiology in the Young and was published just before the beginning of the meeting. And this article focuses on the advocacy initiatives at the World Congress. I would encourage all members on this Zoom call to read this article because it discusses in great detail why advocacy is important and what the important advocacy initiatives were at the World Congress and will be going forward. I would acknowledge the leadership of Bistra, of Amy, and of David Overman, who led the advocacy track and are the co-first authors of this paper. These 3 put in hundreds of hours of work to make advocacy initiatives happen and make them a reality at the World Congress. I had the pleasure of sitting in on many of the Zoom calls that these 3 led, and it's just stunning the amount of work they put into making the advocacy track at World Congress a success. And I thank all 3 of them and tip my hats to their efforts. The efforts of these 3 will save lives. A little bit about some of our advocacy initiatives at the World Congress. The goal was to generate support for pediatric and congenital cardiac care. That was the goal of the call to action. Before we even got to Washington, D.C., this World Congress, Washington, D.C. call to action had been signed and endorsed by 576 individuals and 162 professional societies and organizations representing 64 countries. Those 162 professional societies are listed in a table in the manuscript that I just showed and include a variety of important organizations, including the World Health Federation, World Society of Pediatric and Congenital Heart Surgery, the World Congress Steering Committee, the American Heart Association, American College of Cardiology, CHSS, and well over 162 professional societies have now endorsed this call to action. So it's global support for an important initiative. At the World Congress, we facilitated additional signing of the call to action through this slide, and that allowed many more people to sign and endorse the call to action at the World Congress. In the article, one can read about the 4 pillars of the World Congress call to action, which included increasing capacity to care for patients, building the workforce, financing care, and closing the data gap. And there's a fair amount of detail in the article that I just showed about each of those 4 pillars. In addition to the call to action, there was multiple other advocacy initiatives at World Congress. There was a World Congress Advocacy Scientific Track that was extremely well attended and covered a number of important topics. There was also Global Health and Advocacy Village. I wanted to focus a little bit on this. This was a place in the exhibit hall for organizations from around the world to gather and share their experiences, research, knowledge in the fields of pediatric and congenital cardiac care. The organizations in Global Health and Advocacy Village included patient and family-led organizations, organizations dedicated to medical and surgical missions, non-governmental organizations dedicated to global health and capacity, and non-governmental organizations dedicated to advocacy. Global Health and Advocacy Village was amazing. It brought together 96 organizations from 37 countries. All of these groups attended with complimentary registration. We waived registration so the leaders of these groups could attend the World Congress and have booths in the exhibit hall. And I had the honor of walking through Global Health and Advocacy Village many times, and I was very pleased to see a full and packed village with multiple advocates and advocacy experts talking to each other, learning about ways to collaborate, meeting each other for the first time, and visiting with old friends for decades. It was a beautiful thing. And again, I thank Bistra and Amy and David Overman for leading this. The 96 organizations that were in attendance at Global Health and Advocacy Village are all listed in the manuscript that I just showed. Finally, I'd like to again point out Bistra talked about some of the advocacy initiatives where we went on little road trips from World Congress. I was able to escape the exhibit hall in Washington, D.C. and join the group for a several-hour session at the United States Agency for International Development. This was a wonderful trip. I met new friends, I spent time with old friends, and I learned a lot about the principles of advocacy for pediatric and congenital cardiac care under the leadership of the people in this group. The youngest person in this group is actually a high school student who wrote about this trip to the USAID in his college application and was accepted early decision to Cornell a few weeks ago. So that's just another example of how the work done by this group will impact generations moving forward. Here's somebody who took his time in Global Health and Advocacy Village, wrote his college essay application about it, and was accepted to Cornell, and his career goal is professional advocacy. And I think that's a big deal and an example of the power of what we can do as a group. Finally, I'll finish by just pointing out what the endurable materials are that we're hoping to leave behind from World Congress. The over 1,000 abstracts from over 100 countries are being published in Cardiology in the Young with free access to the world as gold open access. So Cardiology in the Young has created the opportunity to publish all of these abstracts for free. Peer-reviewed manuscripts from the World Congress are being published both in Cardiology in the Young for the non-surgical abstracts and the World Journal for Pediatric and Congenital Heart Surgery for the surgical manuscripts. So that's where the manuscripts will go. We recorded 90% of the lectures at World Congress, all of the landmark lectures, and these recordings are free of charge on the internet in 2 locations. All of the lectures are now posted free of charge for anybody to watch at Hart University, and also the surgical lectures are posted for free at World University for Pediatric and Congenital Heart Surgery. So anybody who did not attend the World Congress can see all of the lectures for free. Not all of them, but the majority of them. Some we did not record. And then finally, we've created an anatomy atlas called the IPCCC ICD-11 Congenital Heart Atlas. I know that Jim St. Louis is on this Zoom call as one of the leaders in the creation of this atlas. And this atlas is available on the internet free of charge for the global healthcare community that talks about congenital cardiac anatomy and the latest nomenclature and anatomy for IPCCC and ICD-11. And this is another deliverable and endurable material free from the World Congress. Again, I'd finish by thanking our steering committee. I know several members of the steering committee, including Christopher Hugo Hammond, are on this Zoom. None of this is possible without their leadership. Our next World Congress will be, believe it or not, in under 2 years, December 7th through 12th, 2025 in Hong Kong. I'm hopeful that the group on this Zoom will have a very large presence in Hong Kong, and some of the activities that Bistra has described and Amy will describe will be front, center, and operationalized in Hong Kong. And with that, I'll finish by reminding everybody our mission statement to improve the global standard for pediatric and congenital cardiac care, or to put quite simply, to make life better for our patients and their families. And I hope that met the goals of my brief talk here. Again, I thank this group for allowing me to be part and to present this material, and I congratulate everybody for the important accomplishments of this group. And with that, I will turn the slides over to our next presenter, which I think is Amy.
Thank you so much, Jeff. I think we are waiting for Amy to come on, turn on her video and share a little bit about the next steps. But I just also want to be, while she's doing that, I want to thank Jeff for his leadership and for the belief that advocacy was an important aspect of the World Congress, which is something that was never done before. And so everyone on the steering committee, including Jeff, was very supportive of the activities that we were promoting.
Yeah, in fact, we tried to make it front, center, and the most important part of World Congress, and I think we were successful. It was really special.
I think so too.
Okay, can everybody see my slides now?
Yes.
Okay, great. Thank you. And my apologies for the delay. Let me get where we are. So the first thing I would like to do as we talk is to just talk a little bit about the history of the Global Alliance for Rheumatic and Congenital Hearts and its relationship to the World Congress of Pediatric Cardiology and Cardiac Surgery. I will note that actually one of the first places that the idea for Global Arch started was at the 2013 Congress in South Africa. And I know many of you who started this conversation with me and Beaster were there at that Congress. Global Arch was founded in Barcelona in 2017, and we brought together a group of, there were 32 patient family leaders from 16 groups that all shared a common goal there, which was we wanted to create a way to bring together all these patient and family-led organizations from around the world to collaborate, to learn from each other, to share action, and to create a common voice. We knew that that was a huge piece that was missing in this landscape, and we wanted to create an organization that did that. If you look on the top, that's the group of the leaders who were there in 2017. And then at the bottom is the group of leaders that we had there this summer in DC. So we actually had over 60 leaders, groups represented at that meeting. And we're very, very thankful. Thank you again, Jeff, for all your support in making that possible. And I should note that from Global Arch's founding, the idea of advocacy was an essential principle in why it was founded, because all of us believed that lifelong care for congenital and rheumatic heart disease patients is a basic human right. So all of us deserve that no matter where we're born. And we all believe that we as patients and people directly affected by congenital heart disease and rheumatic heart disease need to be at the center of pushing for change. So Global Arch's mission is to improve worldwide lifelong outcomes in childhood onset heart disease by empowering patient and family organizations. So we work directly with these patient family-led groups to help empower those organizations and help them serve the organizations the patients and families in their countries. So I want to be clear that Global Arch does not have chapters. We believe that the best way to serve patient families in country is through the groups that are there and who know that their community. So we work to help them be stronger. Currently, we have over 70 patient family organizations in our membership. And in total, because we also include other kinds of organizations in our membership, and we welcome lots of you to join, we include currently 88 organizations from 44 countries. And the majority of our member organizations are located in low and middle income countries. One of the things we did when we met in Barcelona in 2017 is we collectively defined the rights that every person affected by pediatric onset heart disease has. In a nutshell, we declared that we all have the right to heart care that is affordable, accessible, safe, high quality, patient-centered, and lifelong. And we have the right to well-being. So these are the things that are outside pediatric cardiologists directly, but all those other things that make life meaningful and are as important from the patient family perspective, which is protection from stigma, social inclusion, education, employment, medical privacy, and social benefits. And Global Arch, in alliance with Children's HeartLink, did create a document, which is called the Declaration of Rights of Individuals Affected by Childhood Onset Heart Disease, which is another tool which we encourage you to endorse, and many of you probably have. Specifically in terms of advocacy, Global Arch has always put that front and center because in our experience, this is one of the areas where many, many groups need the most support to help them engage in this. So when we talk about advocacy today, lots of times people use advocacy in many, many ways. So we can talk about advocacy for myself. I can talk about I'm advocating at my school to include more whatever. We, in this conversation, are talking about a very specific kind of advocacy, which Bister started with, which is specific targeted action to drive policy change. Okay, so that's from governments or institutions and that kind of government lobbying advocacy. Many groups in many countries do a lot of promotion of awareness. They talk a lot about the problems, but it's a special skill to learn how to figure out who do you go to ask for policy change to make the changes you want. So this is what we do with our groups. We provide training. There's our toolkit. We provide opportunities to collectively do this, so social media campaigns. We do help groups in country and in regions think about, okay, there's so many things in our country that need to be helped. What is one thing I can focus on with the government that might be potentially effective? And, you know, help them figure out how to do that. It's not our job to do it for them, but we can help them go through that process. And then in terms of Global Arch's unique role in this space is where we do see ourselves as playing a unique role and a different role than our individual groups is we can bring the groups together at that global level action. So at the UN, at the World Health Assembly, we can be the convener because we are the only group, actually, as far as we know, that is a global advocacy group on specifically focused on pediatric onset heart disease, so both rheumatic and congenital. And we are the only group that puts the patient family voices at the center. So Global Arch will be coordinating this group and leading this group. I want to also give a shout out for why that is possible. And obviously there's many ways that Global Arch supports itself, but one of the most transformational ways has been a legacy gift that came from Noemi de Stutz. Some of you met Noemi. She actually was she's been at many global humanitarian forums. If you've been there, and also in 2017, you might have met her. She was a lifelong survivor of highly complex congenital heart disease. She was also a MD. She was an oncologist and palliative care specialist. She was an incredible visionary on behalf of the need for both empower patients to take full charge of their lives and also really focusing on lifelong impact. And it is through her gift that Global Arch has been able to invest in this initiative, because as we all know, at the end of the day, this involves, funding, staffing, coordination, all those good things. So I did just want to honor Noemi and her vision of really creating lifelong impact for CHD and RHD patients. So transitioning over to what we're imagining as we move forward. So we did all this great work. We created the call to action. We met with the USAID, World Bank. We had the UN, the side event at the UN General Assembly, which Bister referenced. So what are we imagining in this global coalition? So first of all, I should note that we haven't completely decided on a name yet. I just put Global Coalition for Pediatric and Congenital Hearts, but one of the things we're going to be asking you is, do you have any better ideas? And you will be getting a link to a survey at the end of this call so that we can get lots of your good ideas. So to be clear, we've already framed up some of the foundational goals. So in keeping with the call to action, the advocacy activities that are going to at least start out in this global coalition will be focused on improving CHD and pediatric heart care access in low and middle income countries. So I will note that everybody on this call knows that there is no country on earth where there is full equity and where people get everything they need. That's true. But as is reflected in the call to action, right now, over 90% of the world's children are not getting any access to pediatric cardiac surgery, which means those children are still back where, when I was born in 1961, that's the level of care they're getting. So this is focused specifically on improving care access in low and middle income countries. We're also specifically focused at the global level. And that doesn't mean we're not hoping that all of you do things in your country and in your own space. The reason I'm saying that is because this group's efforts will be focused at the global level. So when you see the USAID, World Bank, things like that, that's where we're thinking about this in terms of this coalition. And then in keeping with the call to action, our eyes on the prize target is that we want to increase government and multilateral investment in pediatric and congenital cardiac care. Okay. And when I say multilateral, that's like USAID, World Bank, things like that. So that's where we're starting. Those are our starting principles. And then I will note that right now, the way we've defined our membership is that it should include, as grew out of the World Congress, patient and family organizations, NGOs of all kinds, humanitarian missions, other kinds of NGOs, advocacy groups, professional organizations, and individuals. So this is an all-in approach. Anybody can join who's interested. The way we're imagining this is that we will have a steering committee that will include both advocacy leaders, okay, so people with high levels of expertise in advocacy. We, of course, know that we always need to include those patient family voices, and luckily many of the advocacy leaders are patient and family voices, so I don't think they'll have a problem there. And then also we know that in our leadership, we need global conveners. So who are the people who have the connections to get us in front of and heard by the leaders who have the power to make change? So this comes out of the World Congress collaboration. We also are proposing today, we have decided on one initial goal. So there are many things the coalition can do, but our first goal that we want to take on for the first 2 years is to pass an assembly resolution at the World Health Assembly, specifically focused on pediatric and congenital heart disease and heart care. Now, to be clear, just to review for everybody, because I know most people on here, I certainly didn't have a good understanding of even what that is until recently. So to review, the World Health Organization obviously is the part of the UN that is focused on health. Every year it convenes, the countries in Geneva for a meeting called the World Health Assembly. What a World Health Assembly resolution is essentially, it's a formal agreement or decision by the member states of the WHO to commit to a specific health topic. Okay, so everybody there, typically a government, will put it forward and say, we are putting forward this resolution. Here it is. It calls for XYZ, and all the countries will vote on it and approve it. And what that means is they have committed at the WHO that they will focus attention on this area. And it also means that the part of the World Health Organization process is countries are actually asked to report. So essentially, when a resolution passes and everybody says, yes, I'm going to do something about this, they will be asked periodically by the World Health Organization, tell us what you have done about this. Tell us what you are planning to do about this. I will be clear, the World Health Organization, at the end of the day, it doesn't fund and it has no enforcement capacity, right? So when resolutions get passed, it's not a magic wand. Basically, it is an extremely important tool. It raises things in the minds of governments. It draws attention to the World Health Organization. It's an important tool, but at the end of the day, the people in country are the ones who are going to have to push to really make it whatever it's going to be, but it's an essential first step. Let me also just back up and say, many of you may know that there was a resolution passed on rheumatic heart disease a few years ago, actually, I think about 6 years ago now, which was, I applaud everybody on the call who helped make that happen. It was a resolution focused on eradicating rheumatic heart disease, and we are looking to that model to learn from that model as we move forward. I should also note that we are still in the exploration phase of this. So we want to do this. We want to learn enough to make sure that our resolution is worded and includes exactly the most effective way to do this. And we are at the beginning of that process. So as we move forward with this, we will be letting the whole group know about it. And we will also be engaging many of you to help us make sure that whatever resolution we put forward is as effective and impactful as possible. With that, I'm going to stop. I'm going to actually invite Kate or Bistra or Katie to add anything that I've left out before we move on.
No, thank you. Thanks so much for covering this. I just want one thing to add is that we believe that such coalition that we're proposing should be hosted with the Global Alliance for Rheumatic and Congenital Hearts, because this is the organization that represents the patient and family voices, and this is the most well-positioned organization to do global advocacy and to have access to different governments. So this was the idea when we wanted to propose this to the group.
Thank you, Bistra. And I should also say that, you know, the other piece of that is that often we talk about stakeholders in this space. The patients and families are not the stakeholders. The patients and families are the people we do this for. Our voice always belongs in the middle, and all advocacy goals have to start with what the patient and families say they need, right? So if we can all talk about what we think patients and family needs, but Global Arch's job in this space is to ensure that what we are asking for are the things that are top priorities globally for the groups, and make sure that that continues. And the other thing I will note is the groups in country, this is what patient family organizations do. This is their job. Unlike all the very busy clinicians on this call, this is, as Global Arch is a model globally, these are the groups that can work in an ongoing way, are most effectively positioned to bring those voices of the voters, of the people in that country, to demand what they need. All right. The next part of this meeting is going to be, we're trying to get some open discussion going, which of course is difficult when you have over 60 people on the call. But what we are asking first, to just get the conversation going, is we want to get a word cloud from each of you about when you think about advocacy in the pediatric and congenital heart disease space, what is one word or phrase that comes to mind? So one word or phrase that comes to mind, and there's the website, there's the code, and I think it's in the box too, 2403-96-6. I'm going to show that for a few more minutes, then I'm going to stop sharing. So go ahead, put that in, and just quick one word. We're going to make a word cloud. So go ahead and do that. 2403-96-6.
And Amy, we've already got some answers, so I'm happy to share my screen so folks can
There
start
we
to
go.
see.
While you're doing that, I would say that the World Congress Steering Committee will be very supportive of all these initiatives. And we will work with our hosts in Hong Kong to create a platform for this information to be shared. So have no doubt that the World Congress Steering Committee is 100% behind the work of this group. And in fact, it's reflective of the actual purpose of the existence of the steering committee in the first place.
And please feel free to share questions in the chat box, as well as we will give an opportunity to do some breakout rooms so people can talk in just a little bit. I think we're running behind though, so maybe we should stop this, Kate, and move on to the breakout rooms, so we can have 5-10 minutes there.
Okay. All right. So what we're going to do next is we're going to have some brief breakouts. What is going to be happening is where you'll automatically go into your breakout room. You don't have to do anything. You will, each group will have a facilitator assigned. Everybody will have an opportunity to offer brief comments about 2 questions. Where could you see a coalition like ours making a real impact? And what I mean by that is the biggest impact, right? So pick some as specific as possible as helpful, because we're going to use this as for guidance. And then, and my apologies, I messed up the numbering here. So it's not both number 1, number 2. After that, what we would like to ask you is specifically what resources would be helpful. What do you personally and your organization need to support your work? So that could be tools, that could be training. So question 1, where do you see us making the biggest impact? And question 2, what resources would be helpful? We gave it 15 minutes. There's probably going to be about 20 people. So if you talk 30 seconds, and each group will assign somebody to report back. We're going to have brief reporting back at the end. And then we will report back after this meeting ends. We will also be giving everybody more information about what was discussed. So with that, I am going to assume that Katie's about to get us to the breakout rooms.
All right. You'll now automatically enter your breakout room.
Thank you.
Okay, now it's just us.
Katie, I need you to facilitate though, because I can't, Amy and I are both on Global
Okay,
Arches
which
account, so we're going
which
to move to
group
the same
needs-
account. I'll do room 2 for you. Okay, I'm moving you there now.
Okay, great.
Okay.
And then Jeff, I'm going to move you to a room 2.
Okay.
Move you
Jeff,
with
the
that.
key thing is to make sure, just call on people.
He's already moved, I think, Amy. All right, Amy, I think you and I have to go together because we're both on the same account. All right, hold on. Okay.
Recording in progress. not only just for outcomes, but for resources as well, working with several other countries. So I'm glad you're a part of this. And
Amy, can I just say something before we? Hello, everyone. Welcome back. I just want to thank everyone for sharing your feedback and your what your guidance is for the next steps of the coalition. The one thing I do want to mention is that we had the opportunity during the breakout sessions to provide feedback and your opinion on where you're hoping for the next steps of the coalition. In follow-up, as I know not everyone probably had an opportunity to talk, that we will be sending a survey that we will ask the same questions and also some additional questions to gather more feedback on your opinion and what the next steps are. As we move forward, we really want to hear from everyone. We want to hear on what you want us to focus on. And while we will have a scope of the coalition, we want to hear from all of the participants. While it is being led by Global Arch believes by bringing everyone together and collaborating, we're building a stronger voice for every patient around the world impacted by congenital, rheumatic, and pediatric heart disease. So while we are leading the initiative in partnership with Children's Heart Link and a steering committee, we do turn to experts within each country on what is impacting you and what do you want to see for change. So please feel free to share that as you are the expert. I'm so sorry. So thank you very much. We're now going to be focusing on feedback and each facilitator, if you could just share 1 minute, very, very, very briefly on what was talked about during your breakout room. And Bishra, I'll turn to you first.
Thank you. So we had strong support for the resolution and not necessarily combining this with rheumatic heart disease because there was already a rheumatic heart disease resolution, so focusing on congenital heart disease. Then we had actually a couple of people talking about NGO collaboration because there is not enough collaboration among NGOs right now. One suggestion was to map all the different NGOs to map their activities and organizations under the 4 pillars of the call to action. And we had one patient representative speaking about awareness for early detection and definitely interest in that, supporting it. And support for more data, which the support provide, not the support, but the World Society database, the World Society for Pediatric and Congenital Heart Surgery and the World Database, very interested in being part of the advocacy efforts, given the global data resources that they have, not just outcomes data, but actually data for what resources are available to clinicians in every country. Hope I summarized it well.
Thanks, Bishra. Jeff or Katie, do you want to provide feedback for your group? And quick, just very, very quickly.
Yep, happy to. So some common themes, I think advocacy around screening, also collaborating with existing groups, both groups who are doing advocacy, but also the groups that are collecting data. We talked a lot about training and data, right? So looking at standardizing training globally, and then also looking for this group to contribute more qualitative and quantitative data and pairing that data with patient voices to be impactful in our advocacy. And then another idea that came up was creating a platform for global purchase of supplies that could support this work globally. Jeff or anyone else from the group, feel free to jump in if I missed anything.
I think that was perfect summary, Katie.
Thanks, Katie and Jeff. Amy, you're muted.
Apologies. So our group echoed many of the themes that have already been discussed. I think that there was support for the resolution. Our group was very focused on, okay, then what? Like making sure that all the participating organizations got the training. So in terms of what people need, really understanding training and how to use that in country. I think that there was two themes that came out also in our group. One is the importance that whatever we do, we focus on the idea that congenital rheumatic heart disease as lifelong conditions, that we worked hard to put that in the call to action, that we make sure that our messaging is not exclusively pediatric, since we know that this is a lifelong disease. And also, right now, the coalition is very narrowly focused on healthcare, and that's a strategic decision. But we also know, and we heard from some of our patients and families from low and middle income countries, that stigma is a huge issue globally in this population, and that is worth its own or additional or adding that in activities as we move forward, that should be a priority for the group. And one of the questions or goals for the group that came up was essentially, one of our most essential tools is how do we all learn how to communicate as strongly as possible why this is a global crisis, why it matters. So not just awareness of the disease, but why should this be a top priority globally? And the group was very focused on that this coalition is uniquely empowered to be very impactful given the diversity of needs. And I hope I got most of what was said.
Thank you, Amy. And I know Bistra had to step off, but thank you to everyone for being so open to provide your feedback and your guidance for the next steps. We will incorporate this as we move forward and look forward to working with you. Now we're just going to wrap up the meeting and provide some insight into where to next. What are the next steps?
Okay, do you want me to share my screen, Kate, or are you going to go ahead and share it?
I'll share, Amy. I have it.
Great, thanks.
Okay.
Great. So in terms of next steps, all of you are about to get an email. It will have a survey link. So for those of you who needed to think and in the breakout group, don't worry, you'll have lots of time to give us feedback. So you'll get the survey link, you'll get the recording of this webinar, and you'll get more information about how we see ourselves moving forward next step. In order to formally join the coalition, you need to fill out that survey. So this is where it's going to have the question, do you want to join? Yes, check that out. And we also just wanted to end by saying we really encourage you to share this with anybody you think would be interested. Again, this is activity focused on policy advocacy at the global level to help the lives of, focused on LMICs right now. If you know people that really support that and you think would be good participants, please let them know, because we would love as many people as possible. There's the question place you can ask, which is our info@globalarch.org. And with that, Kate, do you have any last comments before we close?
No, I just want to take a quick moment to say thank you to all the speakers today, to all of you for joining. As I know, again, it's very late, very early, or also just in the middle of your day. So thank you so much. And also thank you to the World Congress, Jeff, and to all the World Congress committee members and the full team for all your support in this as we move forward. We're really looking forward to the next steps, and please don't hesitate to reach out to Global Arch with any questions, and we'll make sure we connect you to any of the speakers or to any of the participants. Thank you so much.
Yeah, and have no doubt that World Congress, the World Congress Steering Committee, and the leadership of World Congress is 100% supportive and behind these initiatives, and will do anything possible to help and to create a platform at upcoming World Congress meetings for this group to market, share ideas and activities.
Thank you.
Thank you, everyone.